Okay, gonna call the meeting to order. Was the meeting properly noticed?
Yes, it was.
That has to stay open.
Well,
That's fine. Roll call please.
Marge Edwards,
Here,
Gordon Carlson.
Yep.
Bob Grabowski.
Yep.
Josh Podolsky.
here.
Rick Pease.
Yep.
Jerry Harvey Beaversdorf. I hear. Dr. Richard Long.
Here.
Deb Johnson Shoe.
Here,
All accounted for.
okay, thank you. On the agenda, we are going to move 9A
Here.
up to 8(2)A.
Okay, I'll move to approve the agenda as revised. Second.
All in favor?
Aye.
I,
Opposed? Okay, the minutes from the November 14th meeting,
So moved.
second,
we have a motion and a second. Any discussion? All in favor?
Aye.
Aye.
Opposed? Opposed? Okay, the minutes are approved. Public participation,
I don't see any.
okay, correspondence,
None.
new business. Veteran Service Officer, are you on here?
Yes, ma'am. Marge, can you hear me?
Yes, we can, Rick, go ahead.
All right. Good afternoon, Marge, county board members. The VSO report. We met with 50 clients in November, had 211 phone calls and faxes, 250 emails and scanned documents. We had 7 outreach appointments for November. Activities that we had to perform, 11 on the 11th, on the 5th, I supported the 2022 Veterans Bonanza up in La Crosse Center. It's a huge event that's sponsored by the CVSO La Crosse County and the CVSO over in Minnesota. There are 6 other counties that were up there with myself supporting those. They had 86 vendors, 200 veterans came through, and the CVSO has met with 75 veterans up there to file claims, to go over any questions that they had. On the 7th, Scott went to the Mental Health Community Action Team, the CAT workshop. Nikki and they'll update you on that one. The 9th, we did the Toma VA quarterly CVSO and congressional liaison meeting. On the 11th, we had the Adams County in-service day, mandatory training in the morning, and then Scott and I supported the Veterans Day events in Adams County at the high school, and then we went to the VFW and supported their actions, what they did over there. Is there any questions of me on my report?
Anyone have any questions? I want to say thank you, Rick, for working with Bill Reynolds to get the Operation Greenlight set up for the veterans.
Yeah, he did all the legwork on that, so I can't take any credit for that. Just all I did was gave him the telephone numbers and then handed out some light bulbs to the other organizations that didn't have them yet.
Okay.
But Bill did an awesome job on that,
Yes.
and
he
his
did.
staff. You know, got to credit his staff too.
Financial report. Does anybody have any questions for Rick on this veterans financial report?
no, can I just kind of pop in a little bit?
Sure.
My dad is 92 and he's a VA thing, and I just want to also mention that there's services through the VA and through Toma that we're now getting some caregivers from Adams County, and I just want people to be aware of that. If that's available for anybody else too. I don't know if I don't think it's connected with Adams County, but he's in Adams County and he's getting caregiver, a doctor comes there, and there's gonna be a psychiatrist, there's gonna be, it's really a great service too. So I don't know, just kind of keep that in mind that if you can provide those services for people that aren't reaching out. And if you don't reach out, you don't get it. So,
Yeah, we work hand in hand with the VA in Toma. They call us when they have a veteran that needs to file a claim, they didn't realize he could file a claim. And then also they make us aware of any veterans that need more services through the county.
okay. Thanks for all your help.
Thank you for your support.
Okay, thank you, Rick.
Thank you, Marge.
Going down to the new 2A, the Children and Family Services presentation, Tina and Amber.
Hello, everyone. I'm Amber Baggs. I'm an ongoing social worker in the Children and Families Unit. I've been there just about 9 years, and we're going to talk a little bit today about the permanence options we have for kids when they come into out-of-home care. Go ahead. So the first goal that we use, the first and foremost, is if a child's ordered out of the home, reunification is always the first goal that we have for the families. The family is ordered to make changes necessary for children to be safely reunified with them. The court order is usually 1 to 3 years in length. If they're out of the home, it is most often 3 years in length. Cases are reviewed a minimum of every 6 months. More recently, we've been doing about every 3 months to determine what the progress has been and the appropriateness of the goals. If the child's reunified, the family remains open with our agency for the next 12 months. There's a minimum of monthly home visits with the family and the child. And then we continue to provide services to the family such as mental health, respite, parenting, other services that are deemed appropriate for the family. In 2021, there were 22 children receiving court-ordered services. This doesn't include youth justice children who have received court-ordered services. This is just our out-of-home care services for our children. So 19 were in out-of-home care and 3 of the children were successfully reunified with their family. The next permanent option that we have is guardianship. If this is ordered as an option, the court determines that reunification and adoption are not appropriate goals for this family. If the child has a substantial relationship with the out-of-home care provider, sometimes it's a relative, sometimes it's not, then it's determined that guardianship is appropriate. There is a subsidized guardianship that involves foster care licensing prior to the guardianship. If the court orders guardianship of a child, then our agency closes our case after the guardianship is granted. And then our foster care social worker would do annual subsidized guardianship reviews. So in 2021, there were 19 children out of home care. 9 of those entered into guardianships of their caregivers. 5 remained in out of home care and 3 were reunified. The last option we have for permanence is adoption. If the court orders the child in out of home care, adoption is appropriate. If the other 2 are not, the court determines that reunification isn't appropriate any longer and permanence needs to be reached for this child. So the child then is placed with an adoptive resource. This could be the current caregiver that they're with, or we have to do some searching for an appropriate adoptive resource. So then the department will go through the process of termination of parental rights. Federal law requires that termination of parental rights occurs if the child has been out of the home for 15 months. The court process can be lengthy and there's many stages that can be very complex. If TPR, termination of parental rights, occurs, the child then enters custody and guardianship of the state, the Department of Children and Families. And then all 3 of these bullet points have to be met, or the Department of Children and Families has guardianship until all of these points are met. So until the adoptive resource is approved, appeals are heard. And that can take upwards of a couple of years in some instances. And then when adoption is ordered by the state, then the Department of Children and Families no longer has guardianship over that child. So in 2021, there were 19 children in out-of-home care. 3 of the children were successfully reunified with their family, 9 entered into guardianship. 5 children remained at out-of-home care, and 2 children had their parents' rights terminated.
And this is the Clausen family. Michelle and Travis Clausen, became licensed Adams County foster parents in 2017. So they were foster parents for 5 years and they have adopted 5 beautiful children, as you can see. They started fostering for us in 2017 just to be a temporary home for children. They did that really well. They helped reunify a number of families, which is always our goal. And for these 5 particular children, adoption ended up to be their goal after a very long time of working on reunification. So these children have had a lot of trauma in their life. Travis and Michelle have had to go through a lot of education around informed parenting, all the things that we work on here. They've gained a lot of support from foster families, adoptive families, their families, church, everyone they can think of, and they have learned what each of these children needed and have been very successful. So in October of this year, I nominated them for an award, and on November 29th, I accompanied them to the state capitol, where 6 families, including them, received the 2022 Outstanding Adoptive Parent Award. It was an amazing day. They got to meet the Wisconsin Department of Children and Families Secretary Amundsen. We got to have lunch, and the children had never been to the Capitol, so we watched them decorate the tree, and they absolutely loved it. It was a really wonderful day. So just a congratulations to them, and those children are going to have a pretty bright future. The 2 little girls in the yellow, Amber just mentioned 2 kids that were adopted this year, and that was the 2 little girls in the yellow. They are siblings. And the one he is holding and the one in front in the blue dress, they are siblings as well. And then there's a little boy. So a lot of little children that look like they are all put together, and 4 blonde children with a blonde mother is as they go together. So if you have any questions for us?
Yeah, congratulations, Travis and Michelle. That's great.
Any
Okay.
questions?
Thanks, Tina.
Thank you very much. Okay, the October financial report.
So that's included in the packet. Wendy is not able to join us today. You'll note at the end of our finances that for the month of October, that's the report in your packet. We continue to be in the black, which shows that we have a profit. We expect in November and December that you'll start seeing our expenses exceed our revenues. That's pretty typical. This is actually the longest we've been in the black. For as long as I can remember. And so we'll start seeing more of our revenue come in probably January, February, March of 2023 or 2022. We continue to expect that we'll be positive this year. Some of the outstanding expenses that we aren't sure about will be our hospital costs. Are there any questions related to that?
Yeah, I don't know if the dental sealants were on this particular report, but I was wondering if they were still doing dental sealants for kids.
Cody, is that something you want to answer?
Yeah, so our Access to Care community action team that came through our CHA chip last year, we have a community action team that is working on a mobile dental unit through Family Health Clinical. Currently, they're going to be going to all 3 schools, the elementary, the middle school, and the high school, and they will be offering dental cleaning, and then they will expand those to sealants when the time permits. And then WIC here in Adams County, we do offer fluoride treatment as well. So sealants could be coming for adults as well, just depending on the population and the outreach that we can currently take on at the time. So.
Okay, and I noticed none of the costs were being used at all yet.
We moved, I believe that, if you're looking at the 54116 code,
I don't
I
know.
believe that was moved into one of the other codes, and because Wendy's not here, I can't tell you which code it is. I believe it's under the general 54110 code. Under one of the special project codes. I can get you that project code though. Would you like that?
No, that's fine. It's just, yeah, I just got the, I don't even know what code that was through, so.
Okay,
I just noticed nothing was spent on it, so I was wondering if it was still gonna be solved.
no, it continues to be a program that public health wants to be a participant in.
Good.
I have a few questions here for Kelly. On this 30 pages of 30+ pages here, so if I could just look through, I have them by the page. So I have the first page here with our property tax. Can you tell us what the mill rate would be for this tax? On the public?
Kyle,
Yeah, I'm sorry. I was having trouble hearing that question.
the question is, what is the mill rate on our tax levy?
Oh, I don't have that offhand, but it's fairly easy calculation. Would you just like me to email it to the committee at a later time?
Is that what you?
Yeah, it's just a question I had because it wasn't clear on this to me. But yeah, that would be acceptable. Thank you.
Okay.
Over $12.6 million budget, 2.3 million is tax levy. The remainder comes from other programming and services we collect revenue or bill on.
Okay, and then I have another question. It's on page 3. It's item number 43611. And it just wasn't clear. How and what this money is being used, but more importantly, where it's coming from, granted, why is it being granted?
So you're talking about line 43611 Department of Corrections.
Yeah,
So this is for our youth justice services.
okay.
So you heard from Amber talk about sometimes there's kids in care from youth justice.
Mhm.
We do get youth aids dollars that each county receives. The large line that has just a bunch of dots behind it, do you see that?
Mhm.
Those are our youth aids dollars. We claim them for different types of placement or staff wage. The next one, the 047, is for KIP line. It's a special line that we receive to be able to provide services to our youth. And then the AODA is another small project code to be able to provide services to youth who have AODA issues.
Mhm. This doesn't handle any adult issues?
No. No.
Okay. Right. And then, I had a question on page 5. It would be 43643. And then just, I'd like to. Yeah. Now this grant, the community mental health grant. Can you tell us more how this service is provided? I mean, what do they do?
Sure, we help people stay independent in our community. So a lot of primarily adults, some youth who are experiencing challenges with their mental health. Those dollars help provide case management. They might be used to keep them in a placement in the community.
Okay. And then there's another question I have on page 7. This is item number 43547.
Okay.
Now I'm looking at this pandemic plan and I see this budget for $19,500. An annual budget of $200,000. And now it seems to me this pandemic was declared over with a couple months ago by our president, and I'm wondering why we're continuing to have this kind of a budget for a pandemic that's essentially over.
So the pandemic has not been determined to be over yet. We're still following under the pandemic guidelines by the state. These pandemic dollars are dollars from ARPA that are directly sent to us from the state. We're required to have a pandemic plan. We're required to provide certain services, and this is what you see in this line.
Okay. It
I
just
don't
seems,
have that in front of me, but is that for 2022?
This is our 2022 budget.
yeah,
Yeah.
and then they
It'll
have,
still show up in 2022.
yeah, they have the monthly budget and then the annual budget here.
Okay.
So, I mean, it seems like a lot of money to me to be spending for something that, it's just, I don't know, that seems like other issues in the community that are of more importance than.
If we don't expend those dollars, how they're spent, they're categorized for the pandemic plan, those dollars are returned to the state. We can't just build it any other way.
We can't reallocate those
No, we cannot.
for mental health or something like that.
It's not over yet either.
Well, Biden, I mean, he declared that over 2 months ago, so I mean, how much longer is this gonna drag on?
If you check with public health, it is still an issue in this county.
Yeah,
So,
so those regular dollars, if you don't want us to do anything related to that, that's a decision of the committee, and then those dollars will be sent back to the state. We can't reallocate them.
Ask a question, Bill Wimmer, Supervisor 4. Well, I was under the impression that the ARPA funds can be used for other items other than COVID related. So why would they?
Are you speaking about the county ARPA dollars? Those are different than the public health dollars that are in this budget.
Public health are targeted.
We have a specific funding allocation that is specific from the Department of Public Health related to the pandemic. And those are the special.
Thank you.
Madam Chair.
Yes,
Yeah, I was able to go back and I'll just save email. And the mill rate for Health and Human Services is 90 cents per $1,000 of valuation for 2023, and in 2022's budget it was 82 cents per $1,000 of valuation.
thank you.
yes, go ahead.
So. Trying to go in order here. I had a question on page number 9 of. I saw October expenses. For a lot of these line items, I didn't see any expenses for a lot of these. Is that typical? I see Alzheimer's here, I see. A lot of these here.
It would depend on the grant allocation form. Some of these, and Donna, you're on, some of these are specific to the GUAR reporting. The funds come from GUAR. And currently their tool for reporting is not available. So that is not a challenge of ours, that is a challenge of the states. Donna, do you have anything you'd like to add to that?
No, that's correct. So we're just basically waiting on the GUAR to provide us the correct claims form so we can claim out and show our expenses and revenue.
Okay. And then I have another question on page 25. This is line item number 54133.
Can you give me that line again?
That's 54133.
Yeah.
We gotta go up.
So these expenses tie directly to the line you asked about earlier under the revenues related to pandemic plan.
Okay, so this is not another Cause I see a different amount here, $22,051.
That's
this-
related to, these are expenses.
So this is an additional 22,000?
That's
No, so
expenses.
revenues, so the first part of
Okay,
our,
I see, I got you. All right, this is, it wasn't clear, okay. When do they, is there any idea when this is gonna expire? This pandemic
I
fund?
believe our pandemic plan dollars, Cody, correct me if I'm wrong, expends. There is a requirement, it must expend either by the end of 23 or possibly into 24. I'd have to look at the contract.
Correct, yeah.
But it's based on what we have a chunk of dollars, and as we expend it. We work to pay it or to use it up. We aren't continuing to gather additional dollars unless the state determines that there's another allocation.
Okay.
And you're talking about the whole amount, the 3.9. Is that what you're referring to, the ARPA funds?
I was looking at this 22,051.
But you had a question about the ARPA funds, right? When it was gonna expire?
Oh, yeah, yeah.
Okay, so they have to be appropriated by the end of, and I think it's 24.
And the
They have to
pandemic,
be spent
these dollars,
by the 26th.
these dollars might be a little different because they're specific to public health,
Okay.
They're state directed.
but it's in our
Sorry.
contract, and we have a specific line for it.
Okay, thank you. And then I have another question here. It's on page 29. It looks like N30. I'm looking at pull that up, crisis service.
Okay.
Oh. I'm looking at the expenses here, but I'm trying to see, I'm just trying to get a better idea of what the crisis service is or what, how they function.
So this area is specific to, you'll note our on-call costs, and then the social security costs with on-call, retirement costs, our contracted services. That is our 24/7 call center, it's 24/7, 365, it's called Northwest Connections. Our telephone services, if we have phone, cellular phones connected to the crisis workers. The next line is our meals if they go to conferences. The next is mileage if they're unable to use a county vehicle. However, you'll note in the budgeting process, we moved all mileage into under 38, which is an administrative code. Professional training. You'll see our operating supplies and then salaries that are allocated to the crisis program.
Okay, I'm just, who do we have here for job titles? Who's
Our legal case managers.
how many are in there?
Currently have one person in that position and we have two vacancies. One of the vacancies is on hold. Pending to see if we can survive the two.
Now, how are these services prompted? Who prompts these services?
So if someone is in the middle of a crisis, they can either contact the crisis center themselves. Or law enforcement contacts Northwest Connection, or maybe a school staff does. They do the assessment process, evaluate whether or not the individual needs to be hospitalized. They can stay in the community or voluntary hospitalization if necessary. That can happen 24/7, 365 days out of the year. We have on-call crisis staff that are available from 4:30 PM until 12:30 PM and 12:30 AM. That's daily. If an assessment is unable to be done over the phone, an individual is sent out to do the assessment in person to try to do those same outcomes. And then follow-up is done. So anyone who pops up on our Northwest Connections call center, there's a blog, the list, demographic information, situation, scenario, contacts, and then that information is then forwarded the next business day, and we have our legal case manager make contact with that individual and then attempt to enroll them in services. Or if a person is emergency detained, then it triggers our legal system and they go through that whole process.
How are they defining the crisis? How is that defined?
It's defined in statute.
And can
It's chapter 34.
you kind of explain to us a little bit about? that?
I know we have done that in the past. If you would like additional information about crisis, we could do another crisis presentation,
Mhm.
where we talk about the different legal outcomes.
Yeah, it's important. Yeah, I think we should cover that a little more. Now, what if, somebody experiencing a crisis doesn't realize they're experiencing a crisis and refuses any kind of treatment whatsoever, but is a danger to themselves clearly and a danger to others? I mean, where does interference come in where we can,
It goes with that legal definition of crisis.
to me, there's a vague gray area here.
Yeah,
That,
it's a balance between the individual's rights, the safety for the individual, and it comes down to the assessment and totality of the circumstance.
seems like rights come into play here when it's convenient, and rights come into play when it's
Okay,
not.
you're editorializing now.
I mean, we can make people do things during the pandemic, but we can't make them get mental health care, so I just want to make that point. Okay,
Point maybe.
right.
You didn't run out of paper, did you?
No, I got a lot. There's a lot of, there's 30 pages there on the budget, and I have more questions than this, but I'm trying to keep it short for everybody's sake.
No, Josh, thanks for all those questions. They're really good.
Thank you.
There you go.
Thank you. And that'll do it for the budget here. I think I have more coming up here. Thank you, everybody.
Thank you, Judge. Are there any other questions related to the financial report? Okay, we will go on to the director manager report.
Are there any questions related to the narrative?
I noticed that you've got several jobs that are hard to fill. Are these related more to pay or the job requirements?
I think some of both. I think that it's very hard to find staff with bachelor's and master's level degrees. On-call requirements are not something that staff are favorable to. Right now, staff are able to really negotiate wage and they'll go to wherever is.
Well, I found it interesting in your report, just why some of those are so hard to fill in that statewide versus local.
Yeah.
So, yeah.
And you also noted in your report that you're evaluating each job as it opens.
We,
Is that kind of doing job audit type thing that
um,
being done in other departments?
I don't know if it's being done in other departments. We're trying to do it here. We're trying to see if there's a better way, a more creative way to fill a position. If we can't fill the bachelor level, I mean, some of our positions, therapist positions have taken months on months. Some supervisor positions have taken a long time to fill. We're just trying to find out if there's a different way to fill those positions, but still meet the same quality. Trying to have staff taking on additional responsibilities and tasks. We're just doing the best we can.
No, I noticed in your report there, you talked about, bachelor's degree and so forth. Do we put any emphasis on, number one, experience, and also we're heading into different ground today where they're being encouraged to take tech schools versus four-year bachelor, etc. Is there any way to rewrite some of this, or is it pretty much state delegated?
A lot of it has to do with statutes, codes that tell us what we're required to have for positions. One of the hardest things for us to find are master's degree individuals who have the 3,000 hours of providing therapy. So they can provide supervision. That's very challenging to fill those roles. Very challenging. And I mean, some of those positions are open across the state. It's not just us. They're hard positions to fill. They have a lot of responsibility, a lot of questioning, a lot of people. I mean, it's a difficult position. Any other questions?
No, I agree that you can't hire somebody that's not trained in, I mean, there's a lot of factors that are involved in all those positions.
Does anyone else, excuse me, have any questions? Excuse me. Not just of Kelly, but of the manager reports that are included here. Yeah. Moving on.
We move on to the project status report.
Sure.
I think I mentioned last month that we had sent 24 of our direct service staff through motivational interviewing training. That was very successful. There was a lot of engagement, a lot of positive feedback from that training. We're working on coming up with some additional assignments and opportunities for staff to continue to develop those skills related to family-centered treatment. We had a Youth Justice Innovation Grant to bring that to our county. Unfortunately, staffing was a challenge for the agency that we've been working with. They've had some turnover in their therapy staff. We were able to use some of that funding for our Titan Youth Group, which has been very successful. The funding is ending at the end of this year, and we are hoping to be able to still offer the family-centered therapy through our CCS service array. Once that provider is able to train our staff. Fleet vehicles, I believe that that's something that we'll be discussing later in our meeting. The internal CCS service array, we did bring in, we did hire an additional rehab worker at the beginning of 2022. We have 2 excellent rehabilitation workers who are really invested in doing an outstanding job. One is a male, one is a female, so we're very excited to have one of both. And they are working with kids and adults. And then as far as working on the paperless, we continue to find more efficiencies with our paper. And hoping to roll out some appointment text messaging out of our electronic health record, hopefully later this year or early into 2022. We continue to provide telework to those staff who are able to do that. Continue to monitor it, and those staff who are doing it seem to enjoy it. And we continue to see success with it. Any questions?
No questions there. Sure, go ahead.
Report of committee members. The only meeting that was held this past month of those community meetings was the ADRC of Adams, Green Lake, and West Sheridan counties. Marge, do you want to give any update on the governing boards meeting? Or Donna?
We were finally able to have a meeting. We had a quorum. Oh God, excuse me. The only, really about the only thing that came out of it is that we did approve the bylaws. And we're encouraging the managers from each of the ADRCs to also attend this meeting. And encouraging the counties to get some more civilian people on the committee. Because right now it's only county board members that are on it. It's about it, Donna, but did attend. I don't know if you have anything to add, Donna.
I think the only thing is that the bylaws, I think, are being reviewed some more about electronics. So I think at the next meeting is when the final approval will be done.
Yes,
But I think, yeah, the biggest thing is to make sure that we're working on helping find committee members for that board. So that's a priority.
Clarify, you're looking for adults over the age of 60 or adults with disabilities?
Both.
Both. So if you know anyone, let them know.
Mhm.
Okay.
Public health. Presentation. That he's all dressed up for.
I have Ruth will pull up our presentation, so we're gonna be going over our community health improvement plan this evening. As you guys know, we completed our community health assessment last year. It was a 5-year process. There are 4 items that came through that we're prioritizing as a county through public health this year. So before we jump into the presentation, I'm gonna introduce public health community health specialist Nikki Ripp, who has been working hard on our community health improvement plan. She created this presentation to kind of educate and inform you guys on what we're going through to improve Adams County through mental health, access to care, and a couple more that she'll jump into there. So Nikki, the floor is yours.
Yes, thank you, Cody. Can everybody hear me okay? Or Cody, can you help me? Good, okay. And thanks to all of you for letting me come on and share our work that we've been working really hard on. Ruth, you can go to the next slide already. So the reason we've been doing this community action, or I'm sorry, community health improvement plan is not because we chose to, it is because Wisconsin State Statute 250.05 mandates that local health departments regularly and systematically collect, assemble, and analyze the health of a community. This process is known as a community health assessment, which we presented to you last year and was completed in 2021 in Adams County. The 4 top health priorities from our 2021 community health assessment, which is also abbreviated as CHA or the CHA, as you can see on the slide, are access to care, alcohol and other drug abuse, mental health, and nutrition and physical activity. After the CHA is completed, the Department of Health Services Rule 140.04 states that local health departments should develop a written community health improvement plan, which is abbreviated as CHIP or CHIP. This has to be done every 5 years by assessing data, developing measurable health objectives, and partnering with agencies and organizations to cultivate community ownership throughout the entire development and implementation of the plan. Next slide, please. So to complete the CHA and the CHIP, we use this cycle here. It's called the Take Action Cycle, and it's by the County Health Rankings and Roadmaps. The 2 first steps, or the first 2 steps, the assess needs and resources and focus on what's important, was completed, and we followed those steps in the CHA, so last year in 2021. And then the next 3 steps were completed this year, and we're continuing to work on them. So that is the choose effective policies and programs, act on what's important, and evaluate actions. So choose effective policies and programs. The purpose of the step is to explore policies and programs that address each of the priority issues. Act on what's important means that we take action to ensure the selected policies and programs are adopted and implemented so that everyone in the community has a fair opportunity to good health. And then lastly, which we'll be working on continuously for the next 5 years, is the evaluate actions. So the purpose of this step is to discover whether strategies are working as intended in order to focus our efforts efficiently and effectively. Next slide, please, Ruth. So in April of this year, we invited community members to a kickoff meeting where we introduced community action teams. Maybe you have seen them as CATs or CATs. During this meeting, we voted on the 2 health priorities that we're going to work on this year, and then which 2 we're going to develop a work plan for next year. So the group voted that we were to work on the work plan for access to care and mental health this year, and then alcohol and other drug abuse and physical activity and nutrition next year in 2023. So we created these community action teams to further analyze the health priority areas and identify targeted solutions. So individuals from law enforcement, school, health services, extension, healthcare agencies, and interested residents were invited to be community action members. The expected results of the community action teams were to explore the priority area in more detail through root cause and gap analysis to determine which change looks like for each priority area in Adams County. Then create 5 goals for each priority area, taking into consideration social determinants of health, policy, system, and environmental change, and evidence-based practices. From there, we wrote SMART objectives, which are specific, measurable, action-oriented, realistic, and time-bound objectives for each goal, and a list of action steps that will be taken to achieve each of the objectives. And then we developed a work plan with goals and objectives and planned for implementation and evaluation. Health equity and social determinants of health were considered while strategies were chosen. So we actually just completed the work plan for mental health last Friday. So this was a very timely presentation. Ruth, you can go to the next slide, please. I just wanted to put a quick example of each of the 2 work plans that were developed this year. So access to care, in one of the examples of the goals was to increase access to services. Sorry, that's for access to care. An objective for this goal was to increase access to dental services for underinsured, uninsured, and those with Medicare and Medicaid by 100 residents per year starting in 2023. One of the action steps for this goal is work with Family Health La Clinica and bring their mobile dental to sites around Adams County. The most exciting part of that is it's actually underway, and we are having like a practice site in a couple weeks here on the 23rd, Christmas Eve. So that's already underway. And then a goal for mental health is to improve quality of life to reduce the need for crisis response. The one objective for this goal is to implement an evidence-based program to improve healthy family relationships by 12/31/24. One of the action steps that we chose as a group is called Strengthening Families. We have had it in Adams County before. It is a research-informed program that increases family strengths, enhances child development, and reduces the likelihood of child abuse and neglect. Next slide, please. So the next steps are to begin implementation of our work plans for access to care and mental health. So these work plans will be continuously updated and revised based on the changing needs of our community. We will continue to work to achieve our collective goals through implementation and evaluation of our work plans, which serve as guides as our work throughout the next 5 years. Then we're going to form a community action team for physical activity and nutrition and work with the existing alcohol and other drug abuse groups in the county, for example, drug-free Adams County, so we don't repeat the work. Next slide, please. And I'd just like to thank all the individuals and organizations who participated in the development of our plans throughout the year. And a special thank you to all those that were in our community action team. It was truly a collaborative, community-led effort. If any of you, or if you know of any community members that would like to get involved with community action teams, you can contact me with any of the, well, 3 ways. Don't contact me on Facebook, but I guess if you message our Facebook, I can respond to it that way too. And our physical chip, printed chip, is going to be printed out by the end of the year, and it's going to go to physical or to sites around Adams County. And it also is going to be on the internet in the next 2 weeks here. So you can read the entire 20-page chip if you would like. And I'm not sure if there's time for questions, but if there is, take it away.
Thank you, Nikki. Any questions in the room tonight?
Thank you.
Nikki, how many people are in this organization?
In the community action teams, I'm assuming you're asking?
Yes.
Our Access to Care community action team is a smaller group. I would say people attending the meetings is probably 10 to 12 on average. The listserv is probably closer to 15 or 20. And then for our mental health, because mental health was a priority the last CHIPS and CHA cycle, it's a little more robust in the county. So I would say probably 10 to 15 people coming to meetings, 20, 25 are invited.
How can I join those meetings? When are those meetings, Nikki?
can you tell me who is speaking? And I can add you to the listserv right now.
Yeah, this is Josh Pozdolski, Supervisor of Newchester.
And then part of those community action teams, we have key community stakeholders in the county. So like Nikki was saying, from nurses to school districts to, business leaders, things like that, trying to make a change in the community. So you're more than welcome to join. We'll send you some invites. Are you looking for the mental health one or the access?
Yeah,
to-
particularly the mental
Mental
health.
health.
Yes, I'm very
Absolutely.
interested in that.
Yep, we can get that sent out to you. So we'll be meeting in January again, correct, Nikki?
Yes, and the meeting is to be determined. It's usually in person.
Okay. Well, thank you, Nikki. I appreciate that. And good presentation.
Thank you.
And William, I think you had a question.
Oh, I was just gonna say, it wouldn't be very good for my mental health trying to hit that green, but wherever the tee is, I could just see golf balls dropping in the lake.
And we usually do.
And they're done that.
Yeah.
Yeah. Is that Northern Bay?
Well, thank you for the presentation, Nikki. And like I said, public health is working really hard on mental health. We're going to continue working on mental health, but access to care, mental health, nutrition, physical activity, and then drug abuse is something that we're really working hard the next 5 years on. So we're hoping to make a huge dent on that. And as you heard in the presentation and previously, we're getting some good access to care with dental moving forward, which is huge. A lot of people in our community don't have that access. So we're already starting to develop and implement that too. So if there's no other questions, just gonna thank you guys for your time, and we'll have physical copies of our chip coming out soon. Last year I sent you our CHAWS. We'll be getting the chip as well, PDF. If you want a paper copy, we can get that to you. So
Are there any other questions? Thank you, Corey, and
Thank you.
Nikki both. Vehicles.
So I believe that there was some discussion that came out of an admin finance meeting. So we had a quick conversation with Kyle, and I believe Kyle has the information to present today. Kyle?
Yeah, sort of. I don't really have too much. We were waiting to get some price quotes back on some vehicles at AF Motors that they would be willing to sell to the county. And then we were going to compare those to the state bid website to see where those lined up with the state bids. Tara Warmit from AF Motors had sent me this email, and this kind of explains, it's pretty insightful and all the issues that are going on, and then also with them being a Chevrolet dealer and selling fleet vehicles and all of that. Last week I did check with the Chevy dealer that submitted for the state contract, and they are looking at spring of 2023 for orders, but they're not sure when those orders would actually even get filled. So there's a lot of different variables going on. The prices are going up, but then availability is almost non-existent. The Chevy dealer from the state contract, they had said that they placed an order back in September for a Chevy Malibu, and it still does not yet have a build date, and that was as of late last week. So we were intending to have price quotes for this meeting for the vehicles, but we did not get those yet from AF Motors. But Kara gave me permission to put this email on here just so that way the committee has a better understanding of what's going on.
Kyle, does this committee have to approve the purchase of vehicles if and when they become available, or can it be done through admin finance?
So in our fiscal policies, it states that the home committee must approve all vehicle purchases. We do have it budgeted for vehicle purchases in 2023. If you recall, October of 2021 was when the fleet vehicle bids were approved by the Health and Human Services Committee for the 2022 budget. Because we had anticipated that we were going to have issues getting the vehicles, and we were kind of correct in that assumption back then, and we still have yet to have those vehicles.
I could speak to this a little bit,
Okay.
if that's what you're looking for. At the admin FI, I said that we have money budgeted from 2021. And we should utilize that money as much as we can and get as many vehicles. We may not get 5 anymore, we could get 4. Or whatever the case may be, but we should try to utilize that money sooner rather than later, as the prices are going up. I know the school district, because I'm part of that board, we've actually started utilizing some of the used vehicle, like she's mentioned in his email. And we're getting the same type of warranty as a new vehicle for at least 3 years. So I don't really care what vehicle we buy or what we need or what could be bought, used, new, or whatever, but I'd rather utilize that money now as much as we can, if we can, if the prices continue to go up for new vehicles. I know one thing I've heard, that used vehicles, there's a glut of them on the market now, and that those prices are starting to come down a little bit. So if we could find some used vehicles that would meet the Health and Human Services need, I think that we should probably look into that market if possible. I don't know what your needs really are, except all I hear is Malibu's all the time, so I guess I don't know, I just think that thinking that we're gonna get 10 vehicles this year like we thought we were gonna get is a pipe dream, so. That's where I'm at with that.
Well, in addition to that, it's going to be a moving target, and it's one of those things that as things become available, the numbers can change, not only for the cost of the vehicle, but also the number of vehicles. And all that stuff's gonna be looked at and acted on, but there's no guarantees out there now. It's a crapshoot.
Can I ask another question, procedural question? Kyle, the money we put aside last year, not the money we put aside this year. I know one of the things that is one of the bigger problems is you guys have to make decisions basically in days when they call you, correct?
The last time, I think we had 7 days to make a decision.
And that's not enough to get a committee together and stuff. Is it procedurally wrong to say if we give you X amount of dollars, you guys can make that decision without coming to the committee?
I don't know if I want that responsibility.
You gotta be cautious with that.
Okay, I'm just saying, it's just. Then we'll have to put together a committee a lot faster then.
And we can, I mean, it's 24 hours, I think, is the minimum. And so it can be done, but
Well, I'm thinking maybe we could just set a price per vehicle. Right now it's 18. If we said they could spend 25 in lieu of that, I think that would be a little bit different than just giving the whole slew, but I'm just saying, we know that they're not gonna get a vehicle for 18 anymore. That's, I guess, where I'm at.
I guess where I'm at is that, okay, this committee has approved the 21 budget expenses. So admin 5 can really just go ahead and meet and approve the purchase
well, that's
without
part of
having to
it.
come back here again.
I think that's right, but the number of vehicles could change. And Rick alluded to that,
Okay.
that instead of 5, it might be 4.
For the same amount of money.
Yeah. Like I said, it's a moving target.
I know it.
We'll have to deal with it as it becomes available.
Okay. Are there any other questions on this? Suggestions? Okay. Moving ahead, our next meeting. January 9. Is that acceptable? to Everyone. Okay, calendar.
We'd like to possibly do it at if the new EV stuff is set up at the county boardroom, we could possibly move it over there.
We were told it ended 5, wasn't gonna be until the end of January.
Okay, then we'll do it.
Josh,
I just had a question on the director's report. Kelly, can you help me with this?
Sure.
It talks about, a new provider coming in. And I'm wondering who that provider
Are
is.
you looking at under,
It's in the directory.
so we don't have a contract signed yet,
Okay,
so I would not want to discuss that.
all right. It's out there, but okay.
But the benefit of it, if you want to know the benefit.
Yeah, okay, that would be good.
Is that fair? Okay.
Yeah,
We get a lot of complaints from staff, especially our therapists, about having to be on call. It's something that is stressful when you're on call and having to deal with a crisis situation. It's after hours. They don't like it. They don't like being on call. They're paid, I believe, $1.75 an hour. To be on call, I think it's $2.25 an hour on the weekends and holidays. It's disruptive of their whole life.
how
And
many,
it's one of the reasons we have challenges with recruiting. So our therapists are on call and our case managers in coordinated services and behavioral health. So this new provider, has staff who does on-call responsibilities for other programs. They're able to pay a much higher stipend, for their staff. And they'll be able to team the calls, so they'll be able to have at least 2 people going on a crisis call. And we're hoping to be able to increase the number of actual mobile crisis responses. Not just the telephone assessment, but more opportunities for mobile crisis team to go out with this new contract.
okay, I see, I mean, so it's just one person now?
One
that
person,
dispatches to a crisis?
yes,
It's kind of dangerous if the person's unstable.
typically law enforcement will be there until staff get there.
Okay.
And if the individual is calm enough, then law enforcement will leave. If the individual is not, generally speaking, that's probably an indicator that they can't do an in-home safety plan.
So then it escalates from there. I mean, if
It depends.
they can't take them in at that point. And they're clearly a danger. What happens at that point where they're a danger to themselves or
Then they
others?
would have the emergency detention done.
They take them into custody against. their-
Law enforcement,
They do against their will, if the
they
person's
have
dangerous.
to meet a statute requirement.
I'm trying to find this line here, it's that some, like a moving target, talk about moving targets, it's a moving target.
It's really not. I mean,
But
it's
it
very
seems-
clear.
if they're
definition in the
following the
statute.
statute,
Mhm.
And I don't
I'm
know if
sure
you
you
recall
read
when
the
some of the
statute.
council came and also presented about the challenges with, not the challenges, but the legal definition, and he talked about the process. But this different process with mobile crisis, we're hopeful that having a 2-person team can help people stay in the community. It improves worker safety. Perhaps some of those calls that maybe only had an assessment, maybe this time we can do more mobile crisis responses out to the home, see people in their home or whatever environment they're in, and make more informed decisions.
What are the hours they'll be operating?
24/7,
Right now, they cut them off.
8 hours,
So what's the cutoff, midnight is it?
4:30 to 12:30 PM,
Okay.
or 4:30 PM. to
So
12:30
after
AM.
12:30, then what happens?
Then it's the 24/7, 365 mobile crisis.
That would
or
be
the
taken over now.
assessment, the call center.
That would be taken over now, right? But what, I mean, currently, what would happen after midnight or after 12 if there's a crisis?
The individual doing the assessment makes a determination. The reason we have the 4:30 PM to 12:30 AM as our response time is based on the data that we had that supports that this is when the majority of the calls come in.
At night, I don't know.
Yeah. Actually, it's late afternoon, evening.
Right, we'll start.
Mhm, yeah.
Right.
yeah,
So we're very excited about it. We are hoping that this is very successful. We think that this could really be a very positive thing for our community. And it will also be a good thing for our staff as well.
Now, you said increased compensation. I didn't catch that. What are they gonna be paying for?
I don't have a contract signed.
Okay. Nothing else going on? We are adjourned.
All right.
Okay.
Merry Christmas, everybody.
Yeah.
Happy holidays.